Okay, Grace, this is going to be you and me. This is one of our advertising videos, I hope. We're going to try to create a little group or something to help people with dementia, non-vascular or non-degenerative dementia. But what we're going to do is we're going to get started. We're going to talk about it a little bit. So this is by the Cleveland Clinic. Mild cognitive impairment, what happens when you have a slight decline. So we're just going to go through this quickly and discuss it as it pertains to us, right?
Yes.
So it has several possible causes, some of which are treatable.
Yes.
That's the most important thing to know right now. So let's go, because we're going to help people get better, Grace. We really are. So what is mild cognitive impairment? It happens when you experience a slight but noticeable decline in mental abilities compared to others your age. Could be your memory, your reasoning and judgment, your planning and completing tasks like going to the bank and things like that and paying your bills, right? Reasoning and judgment could be like decisions you make about the things, what to eat, who to spend time with, right?
Yes.
Your memory, you may get lost somewhere, right? You may not be able to find your way back. But a normal is normal, right? It's normal as we age. So what's the difference between mild cognitive impairment and mental decline due to aging? Uh, it's natural and expected to have some gradual mental decline as you age. For example, learning new information may take, just because you're getting older, right? It does take longer. Or your speed of performance may get slower. It's very, very normal. Young kids in university take math and science. Middle-aged and elderly people take humanities.
Okay.
Right? That's usually how it goes. So, normal aging doesn't affect recognition, intelligence, or long-term memory. So your long-term memory is fantastic. As a matter of fact, we're going to find out how very, very, very important this is, okay? And as you age beyond 65 years, you may occasionally forget names. I forget them already. And words and misplace things. Normal. With mild cognitive impairment, you frequently forget conversations and information that you would typically remember, like appointments and other planned events.
They all sound familiar to me.
This one here, you miss appointments and stuff, so it interferes. Like for you, your memory can interfere with your insulin use for your diabetes, right? That's why you have a prescription for life-sustaining therapy. But you can really do most things. And what's the difference between dementia and mild cognitive impairment? The main difference between MCI, mild cognitive impairment, and dementia is the mental decline in MCI doesn't interfere with daily living, whereas dementia does. In addition, people with mild cognitive impairment, or MCI, don't experience personality changes that people with dementia can. Many underlying conditions can lead to MCI or dementia. Dementia involves a mental decline in mental function from a previously higher level that's severe enough to interfere with daily living. A person with dementia has two or more of these specific difficulties, including a decline in memory, right? And even your short-term memory has been getting better up until very recently. You stopped taking the drops. I think the drops are important. Your reasoning is exemplary. That's why you're having some cognitive, some problems right now, because your family's having a hard time understanding what you're doing. So it's throwing your reasoning out a little bit. But your reasoning is superb. And your language skills. Well, actually, the thing is you chose me to care for you because you told me there was a problem with the home care and the diabetic care. So your reasoning is better than everybody else that's involved, in my opinion.
Thank you.
Okay? Because you chose the right care. Didn't you?
Yes, I did.
You got to speak up, though.
Yes, I did. I'm happy I had made the right decision.
Right. And your language skills are superb. And your coordination has gotten better. You can walk on the treadmill and stuff. Before you had to walk with a cane, basically you were all bent over. At one point you couldn't even walk, you were in the hospital, right?
You're right.
And then you have a serious decline in mood, which you've had an uplift in your mood as long as you take the drops and everything compared to when you still have down periods, but that's mostly because of conflict, right, Grace?
Yes. Sometimes they were unconscious. There are factors beyond my own control that cause me frustration.
You don't have access to your own money, for example, which really causes a bad mood, right?
Who would not?
And behavior. Your behavior is still great. You love to go shopping. You love to go talk to people. You love to make people smile, right?
Well, that will also make me happy.
Would also make you happy. Your behavior. So you don't have a decline in 2 or more of those.
Okay.
Oh, including a decline in all of those. You don't have a decline in any of those, really. You don't have a decline in any of those. Not since I've known you. You've gotten better. So some people with mild cognitive impairment eventually develop dementia, but others don't.
Okay.
For certain neurodegenerative conditions, mild cognitive impairment can be an early stage of the condition. Neurodegenerative conditions affect your brain and get worse over time. Some people say Alzheimer's disease is like that, right? Some people say that vascular dementia, the new diabetes type 3, is like that. They're neurodegenerative, so they eat away at your brain, right? So that those cells are gone and never come back, right?
Okay.
So if you have a neurodegenerative condition, the chances of getting better are very, very slim. I think in your case, we actually helped it a little bit by using the ketones to clean out sugars that weren't calcified in the brain and plaques that weren't calcified yet. And I think we also used the marijuana to put new myelin sheathing on the neurons and the neural pathways. So I think we helped really, and we also used vascular dilators to make your veins natural, to make your veins bigger in your brain. So I think maybe we did reverse yours a little bit. And what I'm going to go by right now is that when you went into the hospital in the summer when you couldn't walk, do you remember that?
Yes.
You have to speak up, Grace.
Yes, but I don't
Lean
remember
forward and speak into the mic, please. The mic is over there.
the red spot.
Yeah.
Oh, okay. That's a question again.
Do you
please.
remember going into the hospital in the summertime?
I remember going to the hospital summertime, but I more than one time, but I don't know which one.
Do you remember the time when Dr. Barris let you out of the hospital at Mount Sinai? Do you remember when you went to Mount Sinai?
Oh yeah, that one. Yes, the
Right.
first one. Yes.
Okay, so when you were in Mount Sinai and they let you out, even though some people seem to voice opinions about your health,
Yes.
we only go by the facts, okay? We don't go by opinions. Everybody has one of those, right? We go by the facts.
Okay.
And we make them available to everybody too. So you actually had a sciatica jam in your leg, and I showed you the figure 4 stretch and used ice and cured it in a couple of weeks, right?
Yes.
Okay.
It's a big improvement for me, at least from a disabled person. Then by the time you taught me the exercise and the treatment to take, I'm able to walk quite, just like morning exercises.
Yes, that's right. A
Regular,
treadmill.
like a normal senior.
Like a young person, never mind a senior.
I'm a senior.
Okay, so now here's your findings, okay? So you're diabetic. It shows right here, your A1C was 6.5. So that means you're diabetic, I'm guessing, depending, right? Because it's over 6. Usually they do fasting, but this isn't some fasting. Maybe it's not fasting. So it's perfect number, really. A little higher is okay too. Between 8 and 10 normally, and 10 and 12 when you peak after your meal, right?
Okay.
So the important thing here is that we were just talking about neurodegenerative changes that cause dementia that you cannot cure, right? And they check that with an MRI scan or a CT scan. That's what they do, like a CAT scan, right?
Right.
Or magnetic resonance imaging, or MRI. So they did one for you then. It was July 13th, 2023, this year, when you were in the hospital at Mount Sinai.
Yes.
And they said that it is similar to that seen on the MRI scan done in 2018.
Quite a number of years.
So that means 5 years, no change. So it's not neurodegenerative, right? No change in 5 years is not neurodegenerative. We may have actually reversed yours a little bit. Because when I met you in 2022, there probably was. I'm guessing. Because of your diabetes out of control. And then they also say down here, previous MRI scan, not significantly changed. So the same one done in 2018, no change. They checked other stuff in your brain. I don't want to go into it too much, right?
Yes.
But there's nothing wrong with your brain. Even here, stable since 2018. See that?
Yes.
Your brain is the same as 2018. It keeps saying it over and over since the last one. So it's not neurodegenerative. Okay?
I'm happy to hear that. To me, it's good news.
It's the best news because it means you don't have to have dementia.
Yes.
You will only have dementia if the people around you, namely, you know who they are, don't look after you. You're very, very fortunate that you have me and Dr. Bears. Very, very fortunate. Okay, so let me, actually, I should have zoomed in a little bit here. Let me do that, just so people can see it a little bit better. Same as 2018, the MRI scan, similar to that, not significantly changed, stable since 2018, the whole brain, everything, your blood, your everything is great. So let's get rid of this now then, and let's come back to here. So how common is it? How common is mild cognitive impairment? Because you do not have neurodegenerative Alzheimer's now. You know that, right?
Yes, I understand.
So how common is this? MCI? 8% of people 65 to 69, 15% of people 75 to 79, and 25% people 80 to 84. So do you fit in there somewhere?
Well, at the number 2.
Number 2, you'll be 79 this year, so you're 15%, but heading towards the 25% in your age group, right?
Okay, getting there.
Yeah, right. And what are the symptoms and causes? Slight decline in mental abilities, memory loss. You may forget recent events or repeat the same questions and stories. This is why people that are dealing with you in the hospital have to have patience. This is just the way it is. We have to be grateful to have you with us, Grace, and we have to understand this, okay?
Okay.
You may forget the names of friends and family members, which you don't, or forget appointments or planned events, which you do, and you may misplace items more often than usual. I think even if you can just relax, and when you take the marijuana drops, you're calmer. And your glucose level is lower, you can eat more food and everything. I think it's overall healthier, even though right now you're not doing it. I think we can see a decline. Language issues. You may have difficulty coming up with the right words, trouble understanding written or verbal information. That's not true. You just read your discharge report from the hospital today all by yourself, right?
Yes, I did.
And you understood it, right?
Yes, you're right.
Okay. And then attention, you may lose focus or get distracted. Sometimes when somebody's talking to you in an important meeting these days, you will try to change the subject. I think mostly because you can't hear them. And you talk about other things, right?
Yes.
So you have to be careful that you don't portray that and just say, I'm sorry, I didn't hear you. Speak up for yourself, okay? You may have difficulty problem solving and making decisions. Do you have problems with that?
Well, sometimes. The thing is, I think it's not just that I won't contribute all of these challenges to the sickness. Actually, as we get older, we have more issues in the head.
Yes.
I try to put some excuse. Of course, that is not the only reason.
Well, no, but you're right though, and you're going to see that in a few minutes, okay?
Oh, complex.
So, and complex planning, and maybe
Yes.
so like now, like paying bills, taking medications, cooking, household, you need help with all of this stuff, right? You really do. So these are some of the things that you need help with when you, and it's sort of normal. It doesn't mean
Can make my life easier.
you can live in your own home, right? And have it be like that, as long as you have somebody to look after you. Although now with your incident, I'm not 100% sure, but you just said a minute ago that sometimes you almost choose to forget things, right?
You're right.
So here's the positive causes, possible causes. Some are treatable and others aren't. Depression.
Yes.
Okay, you're talking about being depressed right now. You don't have access to your own money. You've been under chronic stress for a long time trying to get funding and trying to get your family to help you. And it's led to a lot of anxiety, even going to the bank lately trying to ask for a financial plan and ask the bank. Your doctor and I, we both agreed that you did a long-term financial plan, right?
That's right.
And you're going and asking for a financial plan. And yesterday they called the police on us, actually. And all we're doing is asking for a financial plan. So that causes anxiety, stress, and depression. It makes you sicker. Also, sleep disorders. This is another reason why the marijuana is good, because it helps you sleep like a baby at night. Do you understand that? Sleep
Wow.
disorders right there, right?
Yes.
And then a vitamin B12 deficiency, but we do give you vitamins. Urinary tract infection, which really I was surprised to see that. People should be aware of that. But most importantly, Grace, sleep disorders, depression, chronic stress, and anxiety. Those are things I help you with every day, right?
Yes.
So this stuff here is all the psychology of it, basically. And so we do diet and exercise, and we do cognitive challenge, and we do socialization, where we go for walks and go to different activities on a regular basis. Do you agree?
Yes, I do agree.
Speak up, Grace, please.
Yes, I agree with you.
Okay. And I also try to help you with your sleep and get you to sleep regularly, right?
Make sure I do this in a timely manner.
And I try to create a temperate environment. You're the one that told me in the very beginning that it's mood and food, mood and food, mood and food. And now I understand what you mean by mood.
Yes.
It has to be a very temperate environment, not just for a diabetic, but for an elderly person especially. Continuity. And then it also says it could be Alzheimer's disease, but you do not have it, and you do not have frontotemporal dementia, and you do not have vascular dementia, because your brain is not deteriorating, right?
You have given me a lot of exercise.
Did I show you the discharge report from the hospital? It says they scan your brain. It's non-degenerative, right? Same as 2018, right?
That's right.
Okay, well, speak up into the mic.
Okay.
So what are the risk factors? Being 65 or older, cardiovascular disease, which you have, diabetes,
Okay.
which we've kept under control. That's how we prevented you from going blind too, because we stopped your diabetic retinopathy, right?
And obesity.
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 Yeah, you used to be
that.
obese too.
But you have to, lead me and guide me to do a lot of exercises.
Yeah, and watch your diet. I changed your diet, the way you eat, healthy lifestyle. That's what our book is about and our course is about. So how is it diagnosed? A healthcare provider will ask about your symptoms, review your medications. You also had a diagnosis many years ago that you were taking too many medications, right?
Definitely, that's true.
And you asked me to help you reduce them, which we did. And So now we're understanding that if it's non-degenerative, then it's stress and anxiety and unhappiness and improper sleeping, right? And here's how you do it. Through a CT scan or an MRI, which is what you had done. So we know, looks for evidence of brain damage. You have no damage.
Yes. Thanks to all my doctors.
No damage. Management. It depends on the underlying cause. Excuse me. If your mental changes are due to causes like the urinary tract infection, sleep problems, mood or medication side effects, your healthcare provider will come up with a treatment plan. So I'm the one that came up with your treatment plan, right?
Yes.
Even though we asked home care to do it, they said they don't have one.
Got yours.
Nobody did this for you except me. Is that correct?
Thank you. Yes.
So, because you had sleep problems, you had mood problems, you had medication problems, and you needed a plan to solve them all. You had major insulin problems, right? So we've solved that, and we sort of solved your sleep, although when your mood or the stress and the anxiety and the depression come back, especially when you don't take the drops, you do not sleep properly. So the USDA hasn't currently approved any medications to treat it, but there are treatment plans that include non-medication options to improve your cognition. Non-medication options, which I give you, Grace.
Okay. I'm trying.
So basically, how can you prevent it? Don't smoke, don't drink alcohol, eat a healthy, balanced diet, which I help you with every day, right? Exercise regularly, which I help you with every day, right? Manage your blood sugars, which I help you with every day, right? Your cholesterol levels, which I help you with in your diet and your blood pressure. Managing stress, I help you with that every day, even though other people in your family get in the way. Getting quality sleep, I help you with that every day. Exercising your brain by reading, learning new skills, or help you with that every day, right? Engaging, is that a big yes?
Yes.
Everything I just said, right? I help you with every day, right?
Yes. I keep nodding my head.
Yeah, but people can't hear you nodding your head,
Okay.
right?
Okay.
Engaging in social activities, seeing your healthcare provider regularly to manage any chronic conditions. So I've been helping you manage your diabetes all along, right? And I take you out places. I do all of those things almost every day.
Particularly reminding me of my appointments.
Not just particularly remind you of your appointments, no. By helping you to eat a balanced diet every day, by designing a nutritional plan for you, a meal plan for you, by taking you exercising every day.
Yes.
By maintaining your cholesterol levels and blood sugars, by managing your stress, by helping you get sleep. Do you understand how important those are?
Of course, I am the benefit.
Okay.
I am the one who benefits.
It's not just about helping you remember something, it's about all of those things. And it's about engaging in discussions like we are right now, and social activities like we're trying to do to help people, right?
That's
So,
right.
the outlook or prognosis. So studies show that about 15% of people with MCI older than 65 years of age develop dementia within 2 years. So that means 15% have a neurodegenerative disease, so their brain is degenerating. Alcohol, if you drink alcohol your whole life, some people call it mush brain. It's the same, too much sugar in your brain because alcohol, sugar, later on you get this problem, okay?
Fortunately, I don't drink.
No, and you do not have a neurodegenerative because we just saw the MRI and the CAT scan report. You do not have a brain that's degenerating. Same as 2018. So 15% of the people within 2 years develop dementia. But it also shows that 14 to 38% of people return to their normal cognition level.
Right.
14 to 38% return to their normal cognition level. So if it's not neurodegenerative, what's the most important things? The diet, the exercise, the glucose levels, the sugars, right? The sleep patterns, the socialization, the challenges mentally, but even really most importantly, chronic stress and anxiety and depression. It's usually the biggest determining factor on whether somebody gets better or not is the plan that's put in place for them by their healthcare worker to prevent all of that, and also how well their family or caregiver implements it.
Coordination of
Very,
health.
very important. So, if you have a diagnosis, you may want to talk to your healthcare provider and anyone you trust about your future. This is why I've been trying to explain to you, you need a long-term financial plan and maybe one with some flexibility. This is especially important if you think you have an early stage of a neurodegenerative condition like Alzheimer's. You don't have Alzheimer's. We just saw the results. So the doctors that say you have Alzheimer's, they're wrong, because we just saw the results of the CAT scan and the MRI, and those doctors shouldn't be putting that in writing, because you do not have Alzheimer's. You do